Hello there, this is Dr. Mintz. This is a 3-year-old patient who had an anoxic event, A-N-O-X-I-C, an anoxic event. This means that the oxygen in their blood was diminished considerably for a period of time, and that could occur because of asphyxiation or strangulation. But what differs in this point in this patient is that you don't have arterial territories affected, or not specifically. You have regions that are more susceptible to decreased oxygen, and that's what we see here. So basically what we're seeing here is low attenuation abnormalities in the caudate, putamen, and globus pallidus, sparing the thalamus, and we also have somewhat of an arterial appearing distribution in the posterior in a portion of the posterior cerebral artery territory. And let's see what else we have here. There's a little something going on in this portion of the anterior cerebral artery territory here, and there. You see that a little bit here, a little anterior cerebral artery territory. But most prominently you have the caudate nucleus head, the caudate head, and the body. The body of the caudate kind of wraps posteriorly along the lateral aspect of the lateral ventricles. So this is an anoxic or low oxygen or absent oxygen event that has caused cell death related to the anoxia and showing a very strong predilection for the basal ganglia, caudate, putamen, and the globus pallidus, which is not distinctly visualized as apart from the putamen, but borders it in this posteromedial aspect. Once again, the thalamus does not appear affected. Now if we go to the next day, subsequent CT, you see that this has worsened. And now we can see areas of abnormality not only in the caudate nucleus and the putamen and globus pallidus, but more clearly in a broad swath of the occipital lobes, which is posterior cerebral artery distribution here, the medial aspect of the occipital lobes particularly, and I think we can see portions of the anterior cerebral artery territory more clearly than on the other case. There's more confluence of the areas of ischemia within the anterior cerebral artery territory, but notice that we still have pretty good preservation of the flow and no significant abnormalities in the tissue of at least still big portions of the middle cerebral artery territory. If you look closely, however, you'll see that this area here appears relatively low attenuation, and I think that's real compared to this, but it's subtle, and there's a lot of beam hardening artifact, probably because of the speed of imaging required in this 3-year-old. And here you have more clearly anterior cerebral artery territory, areas of ischemia and early infarction that have progressed substantially from the study the day before. So this is a devastating event, and it does not reflect diminished perfusion as we're accustomed to as the etiology of infarctions in the brain, but rather in this case it involves an anoxic event, normal perfusion to the brain, but with a low level of oxygenation. This could have reflected a pulmonary problem or a cardiac problem with decreased cardiac output or abnormally low oxygenation in the blood due to lung disease. Respiratory distress, for example. Respiratory distress syndrome is not usually seen in this age group, 3 years old. So it's not a neonate, but we do see some significant progression of the abnormality over the course of 24 hours. So a pretty rare example of an anoxic injury in a 3-year-old patient, showing significant worsening of the findings in the course of one day.